Good evening, everyone. Public health care is part of a collective Canadian identity, but the strain on the system has triggered a new conversation about its future. The Canadian Medical Association is launching consultations about public and private care, saying the latest numbers show while governments still pay for 72% of all health care, patients now pay 11% out of pocket, and private insurance covers 15%. In our Critical Care series tonight, we look at the situation in Quebec, where there are fewer restrictions on for-profit medicine. Here's CTV's Vanessa Lee.
Inside this Quebec operating room, surgeons perform 1,200 hip and knee replacements every year.
It's going to let me continue with my life, and I'm hoping that, sometime in the fall I get to knock a round of 18, right? That's what I'm looking forward to, really. See you after.
The major difference here, this is a private clinic, meaning patients are paying out of pocket.
A hip or knee replacement is around $24,000. It can vary according to the type of surgery.
It feels like a mini hospital with everything done on site, from preoperative appointments to physiotherapy. It's led by 4 orthopedic surgeons who decided to leave the public system, including Dr. Pascal-André Venditoli.
Here at the clinic, I can do 2 times, 3 times, 4 times the volume as a surgeon. Because I have no real limits. So as a surgeon, I'm much better used in this clinic than in the public hospital.
A worrying trend for doctors fighting to improve universal public health care, a cornerstone of Canada's national identity.
They siphon resources from the public system into the private system. So we lose doctors and nurses from the public system, which will actually exacerbate the wait times and exacerbate access to care.
Across the country, wait times are still dragging on for Canadians hoping to have a joint replacement or cataract surgery. Last year, only 50% of patients were able to get a knee replacement within the recommended 6 months, with 57% able to get a new hip in that time frame.
Let's go. Come on. Come on.
Monica Giordano was desperate for the pain in her right hip to go away.
At one time I was thinking, I might as well die because it was so painful. You can't sleep at night. You turn around, you can't. You walk, you can't.
The 74-year-old retired dog breeder says the system failed her. After 2 long years, she got sick of waiting and decided to pay for a new hip.
I said, no, I'm going to take that money that we saved all these years. It's not worth living if you can't have the freedom to walk and to enjoy life.
More and more people are also paying for primary care.
So what we've been getting lately is people who've lost their family doctor.
This clinic charges a yearly membership fee for access to family doctors. Staff say enrollment has tripled in the past year.
If you do need to see a doctor, we're offering you an alternative. And as I mentioned, some people use it as an alternative until they get a doctor in the system.
The reality is Canadians aren't getting the care they need when they need it. Many experts say the solution isn't private care, it's fixing the public system. Vanessa Lee, CTV News, Montreal.